Thank you. So welcome to our webinar, Strengthening Partnerships, Building and Sustaining Effective Coalitions. Next slide, please. We have a really great webinar planned for you all today. Here are our learning objectives. We're going to talk about what coalitions are and what their role is in strengthening collaboration among organizations that serve farm workers and refugee, immigrant, and migrant communities. We're going to talk about how coalitions are formed, how they can be structured, and learn from two very successful coalitions that are actively working in their communities. And we'll talk about some strategies for developing and sustaining coalitions to improve community engagement and public health outcomes. Next slide, please. So before we get started and I pass it over to our wonderful guest speakers today, I'm going to do some introductions. So to start us off today, we have Corey Bissett, who is the founder and CEO of KWB Strategies. She is a seasoned coalition builder and strategist who has spent over 2 decades supporting community groups in driving data-informed change. As the founder of KWB Strategies, she empowers coalitions through dynamic facilitation, strategic planning, and evaluation support, helping them secure funding, strengthen partnerships, and achieve measurable outcomes. Next, after we hear from Corey, we will have Catalina Burillo, who is the Community Health Improvement Coordinator at Trinity Health in Michigan. And Catalina CAT coordinates and provides administrative support to numerous health disparity coalitions, as well as serving on several executive committees and other task force groups. Her role as a coalition coordinator includes research and evaluation, data collection, analysis and management, and strategic planning that can be used for community awareness and action. Her position also includes coordinating and collecting data, writing community health needs assessments specific to her county, assisting in grant writing, and coordinating the prescription for health program, and serving as the outreach coordinator for events in Oceana County. And then after Catalina, we will have Emma Torres and her colleague Feli. Emma is the executive director of Campesinos Sin Fronteras in Yuma County, Arizona. She's the founder and chief executive officer there. And Campesinos Sin Fronteras is a community-based grassroots organization serving farm workers and their families in the U.S.-Mexico border communities of Yuma County, Arizona. They've been working there since 1999. Ms. Torres holds a master's in social work and is a UCLA Johnson & Johnson Health Executive Program graduate. She's also a former farm worker and has dedicated her life to addressing health disparities for the farm working community to reduce the daily socioeconomic, educational, and linguistic barriers that they face. Her leadership has guided Campesinos Sin Fronteras in providing and facilitating multiple services to agricultural families to help them overcome obstacles and become self-sufficient. So we have a star-studded guest speaker lineup today, and we're very excited. We will have time at the end of the session for questions and answers. So please put your questions in the chat and Q&A box, and we will get to them at the end of the session. But without further ado, I'm going to pass it over to Corey to get us started and get our brains going and thinking about coalitions. So over to you, Corey.
Thank you, Katie. So I would like to start today by giving you an overview of what we even mean when we say coalition, and to help you start thinking about what effective coalitions look like and how they operate in order to really improve community health and well-being in their areas. So when I started working in human services, I realized there was a lot of terms being used to describe people coming together to work on issues in a group. Sometimes they're called collaboratives, sometimes they're task forces, and sometimes they're coalitions. And so a lot of times these groups can look very different in how they're structured and how they approach the work. So as we get started today, I want to give you a sense of what I mean when I am working with groups and talking about coalitions and how they can be effective. Next slide, please. So basically, in its simplest terms, a community coalition is a group of community members and organizations who are working together to create and carry out a shared plan to improve the health and well-being of the community. So basically, people coming together, they know what they want to fix, and they're working together to find solutions and work together to implement solutions. So on the next slide, please. Uh, when we think about coalitions, the reason there's value to this is that coalitions are a way to take all of the efforts and energy and resources in a community that are addressing an issue and make sure that we're using them effectively so that our impact is bigger than it could be if we were all in our own organizations or doing our own services and they weren't separate and coordinated. So the reason we want coalitions is because it gives us a shared vision for what we're trying to accomplish, which allows us to unify the efforts. And then because of that, community level change can become possible. So it's not maybe just about the people in the room with us that we're speaking to about what they need, but we're also creating a community in which it's easier for people to get services. It's easier for systems to support the people they work with. And all of the parts and pieces make it easier for people in the community to have healthy, thriving lives. Beyond just their own personal knowledge and skills, which is often what it's easiest to do when we're functioning independently as organizations. So we can use resources more effectively. And I also love to note that organizations that are part of a coalition are in better positions to get grants. I used to manage grant funds and I help groups get grant funds. And what I have found is that grant funders want to know that what you're doing is likely to truly impact the issue you're targeting. They want to make a difference with the funds. And when you can show that you're part of a bigger comprehensive effort that the coalition is working on, so it's not just your part, but how your part fits, you're in a better position to move forward with getting a grant successfully, as is everyone at the table. Next slide, please. But we've all been to lots of meetings. And just having a meeting and inviting people doesn't necessarily mean that we will achieve those benefits. There's some really key characteristics that you want to have in place with a group in order to achieve those benefits. A lot of that comes from having a community-owned plan where people have come together and looked at the issues and decided what they want to work on and how to move the issue forward, which then gives you that shared and clearly understood purpose to unify the efforts. It also allows you to think beyond just the people you interact with for services to the larger environment in which the people you work with get services and the messages they hear about things and the norms around the issue that you work on. It also allows for us to share the responsibility of the work so that everyone at the table is taking a part in a piece rather than just one organization trying to address very big, complex issues all by themselves, which requires us to work without silos. And it also is important that a coalition think about how they can be a catalyst for action in the community so that it's not just the services you provide, but how are you setting up the actual community members and other systems and organizations in the community to take action around the issue through tools and resources that can help them make a difference as well. Next slide, please. So when you think about what kind of coalition or collaborative group you might have, if you have a group already, or if you're thinking about starting a group, one of the first things I encourage groups to do is think about what kind of group do you have or do you want? Because they're not all the same. And sometimes we have groups in community and they come together and the different service systems and organizations talk about what they do. So I think of that as a networking and information sharing group. And what happens there is each group shares what they're doing and they kind of look for opportunities to support and encourage and basically not get in each other's way. And there's value to that, but it's not necessarily what I'm talking about when I talk about these big benefits. There's also a lot of groups that come together around specific programming or service systems where they look at what services exist, how do they work, and how could they make that service system better. So I think of that as a social programming group. And that's also not quite what I'm talking about. But there is still value if that's what your group needs or what your community needs. I'm typically talking about community development, where you're looking to mobilize broad support and then provide community members and other stakeholders with tools and resources so they can all take action to address the issue. So if you have an existing group, sometimes the frustration is that you aren't the type of group you want to be because that's not how you were set up. And this can be a helpful framework to think about that and do a little kind of assessment for your own group. Next slide, please. When it comes to becoming the type of coalition I'm talking about, I often recommend a framework that came out of the Substance Abuse and Mental Health Services Administration. And it's not that complex, it's not rocket science, but basically what they're recommending is a phasing system where you look at the needs in the community to really understand what's going on, what's contributing to the problems or the issues you're trying to fix, what are the resources and what's the readiness to address those, and then building capacity to bring people together, bring resources to the table, and then making that plan where you all work together to look at those needs and the resources and capacity that is in place in order to figure out what you actually want to do to address those needs. You then do the plan and you evaluate whether or not it's working the way you intended so that you can get better at what you do and also celebrate the successes in the community. And I want to note that this is a circle because you're not necessarily done. After you've done this process, you're revisiting your community needs and kind of moving through sequentially over time to make sure that you're staying up to date on what's going on with the needs and the issues. So it gives you a framework for thinking about that. Next slide. So I want to talk to you about what is a strategic plan, because it's kind of the glue that holds all of the parts and pieces together that I'm talking about with what you're trying to accomplish. So I really recommend coalitions do have a strategic plan, and it doesn't have to be huge. It doesn't have to be massive. It can be as big or as small as the scope of the issue you're trying to affect. And what you want to do is make sure you've written down somewhere what it is you're planning to do and how that logically will address whatever those needs are in the community. And this is important because it gives your group a guide for staying focused on the things you're setting out to fix. It also lends credibility so that others in the community that you're trying to get involved or that you're trying to support can understand what you're doing, why you're doing it, and also just having a strategic plan lends credibility to the fact that, you have a plan. Always a good idea to have a plan. It also gives you a framework for evaluating success, because if you have a plan, then you can monitor whether or not it's moving forward the way that you would like to see it move forward. All right, next slide. So coalitions are uniquely positioned to target really complex issues because you can bring all the resources and stakeholders and partners together to address the needs, the various needs, not just like one part of the need. But in order for this to work, you really have to be around long enough to make a difference. It takes time to affect complex issues. So as you're building a coalition, you want to be sure that you're thinking about the sustainability of your group so you are around long enough to do the work and see the change that you want for your community. So coalitions that do certain things are more likely to be around long enough to make that positive impact. So as you build a coalition, you think about these things. Don't wait till 5 years in and then say, oh, what do we need to do for sustainability? So when I think about sustainability, I really recommend that you build ownership amongst the stakeholders. So get the people at your table and share the ownership. One group doesn't have to be the owner and the representative and claim the success. It's really about all the players at the table and how they are all taking a piece. which then lends to developing champions so that you have others in the community who maybe aren't staffed the coalition or from even the starting organization who will brag about the coalition, celebrate what the coalition is doing, and really work to get the community to recognize and participate in what the coalition is trying to do. I also highly recommend thinking about having diverse resources. So if you're entirely reliant on one funding stream or one organization, it can be very hard to sustain if that falls apart. So from the get-go, think creatively about how to support the work that you want to do. You also want to track and publicize outcomes. And this is hard to do when we're constantly focused on the efforts that we're doing. But if you're celebrating successes, it helps your members stay more committed and it helps the community buy in and recognize the value. You also can invest in strategies that last. So if you think about changing community norms or policies that make it easier for people in your community to make good choices and live healthy lives, then those things last beyond your attention to them. And so always be thinking beyond the specific services with individuals to what can you do that will last, and always evolve and grow. So you want to have a strategic plan, you want to stay focused on your targets, but you need to allow the group to identify when community needs have changed and also when opportunities and partners change so that you can shift and take advantage of those things because that keeps a group fresh and it keeps a group committed. Next slide, please. So I get really excited about coalition work. It can be a bit overwhelming, and I just wanted to give you a snapshot. So I'm leaving you, before I hand you off to the other presenters, just a few resources that I think might be helpful to you if you're looking to pursue this work. The first is a mini assessment if you're thinking about starting a coalition to help you know if that's maybe the right approach to what you're trying to do. And then basically two toolboxes, a toolbox and a resource kit from two other groups that have a lot of really good tangible guidance on how to move forward with developing, maintaining, and succeeding as a coalition. So thanks so much for letting me join you today. Katie, all done.
Thank you so much, Cordy. That was a great foundation setting to jump into our next two guest speakers. So I'll pass it over to Catalina.
Hi, good afternoon, everyone. Can you hear me all right? Okay. I've known Corey for a long time with KWB Strategies, and it's a little nerve-wracking to present after her, but I'll do my best. She does a great job. That's why she's the expert at forming coalitions and evaluating coalitions. So you'll hear me talk about her from time to time throughout my presentation. My presentation itself, some of it is scripted and some of it is a little bit more casual. Go ahead and go to the next slide, please. When I say scripted, I mean there are a few, slides that I have to review as being part of a larger health system. So I work for Trinity Health. We are one of the largest Catholic healthcare systems in the nation. I will go through these slides rather quickly so we can spend more time on the nitty-gritty of coalition work. But as you can see a little bit about Trinity Health, we are 123,000 colleagues strong, and we are in all the green states that you see highlighted there on the map. We have 8.3 thousand employed physicians and clinicians in the United States and 26.6 thousand affiliated physicians. So overall, we have 88 hospitals and 17 clinically integrated networks and 136 urgent care locations. So that's just a little bit of truth about Trinity Health that I have to share with you. I myself am in Michigan. Next slide, please. So I am in the west side of Michigan, so on the lakeshore side. And we recently had Grand Haven join our ministry. So we are now 3 hospitals along the beautiful shore of Lake Michigan. And we are a unified 463-bed health system with an even greater potential now to enhance services to the thousands of lives that we serve. Together, we have over 4,000 colleagues in our region, and we do 18,000 inpatient discharges a year, nearly 2,000 births, and we perform 17,000 surgeries each year. At Trinity Health Lakeshore, we have amazing, dedicated colleagues who deliver exceptional medical care for thousands from birth to end of life. We strive to continuously stay on the forefront of medicine, maintain the safest standards and highest quality of care. And in your slide, you can see a little, I don't know what that is. Is it a star? Is it a little purple thing right next to where it says Shelby? And that's exactly where I'm at. So on the west side of the state. Next slide, please. So every 3 years, Trinity Health conducts a community health needs assessment in each of its ministries and commit to helping with locally prioritized issues. So again, the 3 that you see on the right-hand side are the Muskegon, Shelby, and Grand Haven community health needs assessments. Issues that we've prioritized in the past and currently are access to food, access to healthcare, housing, childcare, and homelessness. And we assist by providing funding, leveraging community partnerships, and enhancing our efforts to help the community. So I'll speak a little bit more to the community health needs assessments in just a moment. So they do play a pivotal role in our work, in our coalition work. So when you get the slide presentations, there is a link on the bottom that you can access those health needs assessments for yourself. Next slide, please. So now we're going to dive into how coalitions work. So you heard a lot from Corey White-Bissett and KWB Strategies. And as I mentioned, I will be mentioning her throughout because Corey has worked with us in collaboration to do trainings for our coalition leaders, as well as our evaluations. So she's been a great asset and partner. Some of the things to note is that in the past 30 years, we as Trinity Health along the Lakeshore have facilitated 24 collaborative teams or coalitions with over 640 community members involved in Muskegon and Oceana counties to have collective community impact. So these represent over 113 organizations. And the groups of community members that have formed coalitions have rallied around particular health issues, as Corey was just mentioning, and are committed to working together to resolve the problem and identify solutions. As I was just showing you the community health needs assessment, these coalitions align with our community health needs assessments priority areas. And just in the slide that you're seeing, the above logos, they're Define the Lyme Coalition, Muskegon Health Disparities, No Smoke. These are our current active coalitions that we have that are led by our team that we are working hard to create a lasting impact in our community. So coalitions and the way they work, as we just mentioned, right? The first bullet, convening around an identified community issue. Then you have your governance structure and your strategic framework, which is what Corey was just talking to you about. Staffing and fiduciary management. So that's, for example, where I come in. I'm a staff person who works on coalitions. And that could be anything from communication and organizing and sending out emails and correspondence, posting on social media or working on newsletters, to fiduciary management, so budgets. Coalitions also require membership recruitment. And of course, data-driven decision-making is also a priority for our coalitions. As Corey mentioned, we do strategic planning. Generally speaking, we do it every 5 years, but we actually do our action planning every year. So every year we're taking a look at all the data that's coming in again. We're deciding, how we need to pivot and change based on what we've done and where we're going and what results we've seen and what still need to be worked on some more. So, and of course, provide resources for implementation. So that could be anything from publications to financial resources, etc. Next slide, please. This slide talks about my role as a colleague, right? So Trinity Health's community health well-being, which is what I'm a part of. We manage coalition activities, ensuring that the data-driven strategic planning and implementation of community-level strategies. So we do meeting facilitation. We can form action teams. We can organize events. As I mentioned, we do marketing and communications. We are sort of at the in charge of budget and finance, and we work on things such as websites, newsletters, social media. We're basically the behind-the-scenes support, and we provide communication and resources. And when I talk about budget, budget in this case is really looking at your annual budget with your action plan. So you can make sure you're putting in enough money toward toward, for example, evaluation, as I spoke about, or toward training if your coalition leaders need training. So you're really making sure that your annual budget is reflecting those needs. And of course, you know, there's always priority shifts. The other thing is, for example, in during COVID, we had to do some shifting because of the pandemic, and you know, the priorities shifted for people, so, and our partners. So our financial future for some of our coalitions was a little bit uncertain. So we had to approach, you know, different funding sources for sustainability. And one of those sources is the hospital system itself, and tapping into some of the community benefit money that's put out there. Next slide, please. This slide is about capacity and branding. So, of course, as you're looking at coalition capacity, you are going to look at, you know, your leaders and their, you know, what their leadership style is, and if they have an effective leadership style. Collaborative leadership, of course, is the best to have in a leader when you're working with coalitions. You want to build not only a leader as far as maybe a role like a chair, for example, or a vice chair, but you also want to build leadership among your members. You will be working together with your chairpersons, and of course, you will also be connecting and engaging with community leadership. One of your goals or roles is to diffuse leadership responsibility, so it's not just falling on one person. Another thing to take into consideration is all individual contributions are solicited and acknowledged. So it's not, you're not working in silos. Everyone shares in their leadership decision-making procedures. So, for example, one of your first tasks as a group is going to be how do we make decisions? Are we going to raise our hands? Are we going to vote yes or no? Is it going to be ayes or nays kind of thing? So you're going to look at those things. And of course, you're going to look at what's the most effective anatomy for your meeting, right? How do you want it to run? How is it going to run best for your group? And of course, sometimes for membership recruitment, we do CIAs, which is a coalition involvement agreement. And sometimes we do MOUs to set terms and agreements with partners. One of the things you need to do is define who should be involved in your coalition. Who are you missing? What sectors need to be represented? I also mentioned earlier that we have partners such as Corey White-Bissett, who does the coalition boot camp for some of our coalition members, or we do coalition retreats to work on more leadership training. Next slide, please. This slide here is basically kind of diving into one of our coalitions, and this is one of the coalitions that I lead. It's called Oceana Healthbound, and it was formed based on empirical data that showed both a lack of information on minority health issues and a disparity in the state on the health of minority populations. So this coalition was formed, and just because of time, I'll go kind of quickly over this. Healthbound is committed to promoting a healthy community through the procurement of new health resources and the collaboration of existing ones. We do our strategic planning. We do long-term strategic planning and prioritize our issues. So, for example, our priority issues are diabetes, obesity, overweight, and access to health services. So, some of the things that we do is to increase the capacity in our county to provide both diabetes education and chronic disease self-management for those populations with diabetes. We also try to make sure that our materials are published in the Spanish language as well. So that's kind of our target community here in Oceana County. Since our data shows that our Spanish-speaking populations have a higher prevalence of diabetes. We also do cultural competency training as one of our priorities. And another major focus that we do is creating opportunities for families to learn about and obtain healthy food. So we've implemented the Prescription for Health program here in our county. And we've enhanced access to healthy foods at the Oceana, or excuse me, at our food pantries. We also developed a health passport to keep information about health status and prescriptions. And recently, we just received a grant from the CDC to continue on with our work. So some of the things we do is go where people already are gathering. So, for example, such as a Farmworker Appreciation Night event. We've had 4 other outreach events. We collaborate with our partners in the community to do health screenings. As far as funding partners go, oh, I'm sorry, let's go to the next slide. My apologies. So this just talks about our key partners, key stakeholders. These are individual folks who are partnering with us to do not only collaborate with us at coalition level, but to do health screening. So we have health department, hospital systems, physician partners. We have the FQHCs. We utilize our cooperative extension, oftentimes for education purposes, and fitness centers for physical activity, et cetera, et cetera. Next slide, please. So implementation action teams, we talked about that already briefly. We go through this process. Like I said, we do annual action plans based on our logic models. And we do have quarterly budget meetings. And sustainability can look different for everyone. We tapped into resources such as our community foundation, our Lions Club International, senior resources, as well as our Oceana Hispanic Center, and our hospital. And that can look different, right? It's not always asking people for money. Sometimes it's asking to have them be the host location for a training or for a meeting. Next slide, please. Oh, I think I missed a slide here. My apologies. So again, back to evaluation, you're always going to want to evaluate and pivot each year. You really want to assess feedback on your processes. You want to look at any barriers and obstacles that you faced. Of course, continue to review your structure and talk about best practices. Conducting pre and post surveys is always helpful as well. And next slide, please. Oh, sorry, the next slide was questions, and we're going to take those at the end. So my contact information is available for you as well, and it'll be in the PowerPoint slides when they are shared out. Thank you.
Thanks, Catalina. Okay, so we've gotten our foundation of what coalitions are, and we learned a little bit about Trinity Health Systems coalitions. And now we're going to head over to a community-based coalition coordinated by Campesinos Sin Fronteras, and I'll pass it over to Emma. And if we could go to the next slide real quick, Vanessa. Emma will be presenting in Spanish. So if you would like to hear an English interpretation, please use the globe icon and select the language in which you would like to hear for the next portion of the webinar. Okay, I'll pass it over to Emma and Feli. Thank you.
Gracias.
Thank you, Katie. En español, vamos a hablar de nuestra coalición de trabajadores agrícolas del condado de Yuma, aquí en Yuma, Arizona. Y pues ya escucharon de Corey y de Catalina sobre la formalidad de una coalición, ¿verdad? Cómo se establecen los fundamentos. Ellos lo escribieron muy bonito y me gustó mucho porque nosotros no seguimos ninguno de esos pasos, ¿verdad? Nosotros empezamos formalizando la coalición muy informalmente, un grupo de personas que queríamos, pues, que éramos trabajadores del campo, que habíamos trabajado en el campo y que queríamos ver algo diferente en nuestra comunidad. So, así empezamos a reunirnos, a juntarnos, a ver qué podíamos hacer sin tener una idea de un fundamento de cómo se hace una coalición, como simplemente un grupo de personas que dijimos, ¿sabes qué? Hay que hacer algo, ¿Qué hacemos? Y de esas personas fue que empezamos a formar la coalición de servicios para trabajadores agrícolas del condado de Yuma en el 1994. La siguiente, por favor. Entonces, esta coalición de servicios para trabajadores agrícolas, como mencioné, la formamos en el 94, pero ya éramos personas que algunos habíamos trabajado en el campo y ya estábamos trabajando en una clínica o en alguna parte. Yo trabajaba en el programa del WIC y era trabajadora de nutrición y ya conocía a otras personas. Así fue como fuimos haciendo la relación de aquellas organizaciones o aquellos grupos o individuos comunitarios que teníamos la misma inquietud. ¿Cómo le hacemos para hacer algo para nuestra gente? ¿Cómo formamos un grupo a quien le podamos dar servicios que necesitan, que ellos no van a pedir, porque ellos no vienen a pedir, que no saben el idioma, que no saben ni a dónde ir? Nosotros, sabiendo todas esas necesidades, dijimos, ¿cómo nos juntamos para hacer esto? Y de hecho, así fue como nació la idea de formar la coalición, ya hace más de 30 años, y lo encontramos, como mencionó, creo que fue Corey, una área común, un propósito que todos teníamos, que era mejorar la calidad de vida del trabajador agrícola. Entonces de ahí fue que dijimos, vamos a hacer una feria de salud. Es como que lo más común que todos sabemos hacer. Vamos a reconocer que nuestra gente trabajadora del campo contribuye mucho a nuestra economía, que su trabajo es duro, pero que aquellos están aquí. Entonces, estamos en una comunidad donde se hacen muchas fiestas para las personas que vienen del invierno, que los visitantes de la nieve, como le dicen, los pájaros de la nieve que vienen aquí en el invierno, y toda la comunidad se juntaba a agradecerles a ellos, pero no a nuestra gente campesina que también venía de otras partes para ayudar. Y así fue como dijimos, vamos a hacer una coalición, pero otra vez sin mucha formalidad. Y pues, pues ya tenemos más de 31 años. Adelante, la siguiente, Elimina, sí. Y pues nuestra visión era esta, que ningún trabajador agrícola del condado de Yuma sea marginado, que no se quedaran fuera de tener servicios, y que con nuestra misión era la de unir esfuerzos y recursos para mejorar el nivel de vida de los trabajadores agrícolas, sus familias y las comunidades del condado de Yuma y otras organizaciones locales y estatales que nos íbamos a juntar para hacer esto posible. A la siguiente. Algunos de los socios, creo que Catalina mencionó, hay unas personas que se quedan que tienen 20 años y algunos hasta 30. De estos grupos que tenemos aquí, algunos de ellos ya tienen muchos años con nosotros, de 10, 15, 20, hasta algunos 30 años, que fueron de los fundadores de la idea todavía y que todavía siguen siendo parte crítica de nuestra coalición. En ocasiones, alrededor de la formación del Día del Campesino, que al final Feli va a estarles hablando de cuál es ese evento, se llegan a juntar hasta 25 o 30 organizaciones que primero una vez al mes, después cada 15 días, después semanalmente están allí porque quieren ser parte del esfuerzo que esta coalición forma. La coalición se triplica y se fortalece mucho 6 meses en el año, que es cuando estamos organizando el evento del Día del Campesino, y después los otros 6 meses ya se bajan a un número más pequeño, 15, 20 personas, que seguimos hablando de otros temas. Creo que Cori fue la que mencionó que hay diferentes razones por las que la gente se une. Una es para hacer el networking, ¿verdad? Para conocer qué está pasando, qué está haciendo aquí. Otros para ofrecer servicios, otros para desarrollar esfuerzos comunitarios que tengan que ver de cambiar pólizas o algún problema que está sucediendo, como aquí en nuestra comunidad. De repente, que a la gente que era retirada no le estaban dando desempleo. Bueno, de ahí entramos entre todos, porque en nuestra coalición están las personas que trabajan en el desempleo, están las personas que trabajan en diferentes sectores que pueden ayudar a nuestra gente, pero a la vez allí fue una mezcla de networking, de servicios y de póliza, porque cambiamos la póliza para que pudieran reconocer que ellos eran dignos y que merecían ese servicio porque trabajaban 6 meses. Mínimo les tenían que dar el desempleo que habían juntado en ese tiempo. Entonces, esa fue una de las razones por las que algunas de estas organizaciones han mantenido pues trabajando juntos con nosotros porque tenemos un propósito común a la población, ayudar a la población campesina a tener mejor calidad de vida. Entonces, esa ha sido nuestra manera de sostener este grupo, porque ¿le pasas a la otra, por favor? Porque aquí se menciona cómo se lidera la coalición, aunque aquí más bien pusimos cuál es el proceso de decisión cuando tenemos un problema o algo. En realidad, no tenemos una estructura de coalición. Yo he intentado en estos 30 años de traer a poner a alguien más. Hemos hablado de las reglas de Robert Rules of Order, ¿verdad? Le hemos hablado de eso, hemos hablado de establecer que haya un presidente, un vicepresidente, un secretario, un tesorero. No ha querido la membresía. Se sienten a gusto como se trabaja. Nosotros facilitamos las reuniones, pero mencionó también, creo, Corey fue la que dijo, pero la coalición le pertenece a todos. Es una de las cosas que les hemos querido decir. Esta coalición, si hacemos mucho, se va a lograr mucho y se le va a dar a la gente el beneficio. Si no hacemos, pues no tenemos de qué coger crédito ninguno, porque no estamos haciendo ningún cambio, no estamos logrando ayudar de ninguna manera. Entonces, eso es lo que creo yo que ha dado esa flexibilidad de que la gente puede venir o no venir, pero que su interés y de ser parte de un cambio para ayudar a nuestra comunidad campesina es lo que los va a hacer a ellos estar ahí presentes, como son esas organizaciones, esas 12, 15 organizaciones que no han dejado de estar aquí por 30 años. Entonces, es bien importante recordar que no todas las coaliciones van a trabajar de una manera muy formal. Nosotros como campesinos, como trabajadores agrícolas, como comunidad fronteriza aquí, la comunidad no ha querido hacer la coalición no ha querido hacer eso. Campesinos Sin Fronteras trabaja con 5 coaliciones. Con esta de los servicios a los trabajadores agrícolas, trabajamos con una antidrogas, trabajamos con lo de la prevención de la violencia intrafamiliar, trabajamos con la de la salud de los jóvenes y trabajamos con la de las promotoras. Entonces, yo he aprendido y se mencionó que la mejor manera de trabajar donde hay pocos recursos es encontrar aquellas a personas o grupos que tienen una misma misión que tú de ayudar a la población con el mismo propósito de mejorar su calidad de vida. De esa manera es la única manera que alcanzamos nosotros a estirar nuestros recursos porque todos ponemos un poquito en la cajita, como decimos, y de ahí distribuimos. Entonces, esta coalición fue antes que la Organización de Campesinos Sin Fronteras. De hecho, de esta coalición nació Campesinos Sin Fronteras. Entonces, yo le voy a pasar los últimos 3 minutos o lo que queda a Feli para que hable del Día del Campesino, de esa feria de salud anual que todavía es el pegamento que sostiene a esta coalición. Pasado a este día que suceden cosas increíbles y a todo el mundo se emociona mucho, es que la coalición se mantiene unida y fortalecida, cuando menos por 6 meses está bien presente y buscando recursos para sostener la coalición, ya que no tenemos de otra manera de cómo traer esos recursos a la comunidad. Así que la próxima, por favor, y Feli, adelante.
Adelante, por favor. Como mencionó Emma, la coalición de trabajadores agrícolas de aquí del condado de Yuma, pues fue establecida en el 94 y por 31 años, o con este año van a ser 31 años que vamos a poder brindarles servicios am, de salud a nuestros trabajadores agrícolas y generalmente lo hacemos en la madrugada, dado a que nuestros trabajadores agrícolas, las horas que trabajan, pues no son convencionales, no son servicios que ellos pueden recibir de 8 a 5, sino que son servicios que hacemos, que se los brindamos a ellos en la madrugada, porque es cuando ellos pueden ir a recibir esos servicios. En esta feria de salud para el Día del Campesino, en honor a ellos, pues se les ha brindado servicios dentales, vacunaciones, exámenes de salud, de presión arterial, de diabetes, glucosa. También se han dado mamografías y también se dan servicios sociales que son beneficiosos para ellos o recursos para ellos, como son información sobre derechos laborales, donde pueden ir a recibir ayudas, servicios de inmigración. Son muchas las agencias que se unen en este evento. Hemos tenido hasta 46 agencias a veces en este día, en este evento. Se da servicio a entre 3,000 a 5,000 trabajadores agrícolas en un promedio de 4 o 5 horas. Generalmente empezamos como a las 10 de la noche y se abre a los campesinos a las 2 de la mañana. Eso es un gran evento y los campesinos pues se ponen muy contentos al recibir estos servicios porque generalmente los comentarios que nos dicen que esto no se hace para ellos. Entonces, como les dimos, es un honor para ellos. La siguiente filmina, por favor. Aquí están algunos de los organizaciones o agencias con las que hemos colaborado. Como le hemos dicho, son más de 40 agencias, entre ellas el DIE, Chicanos por la Causa, como se mencionó anteriormente. Y durante el año, pues nos seguimos reuniendo por lo menos 25 agencias mensualmente. Tenemos la coalición a cada tercer jueves. Los invitamos al que se quiera unir para trabajar juntos, pero estos son con algunas de las agencias que trabajamos, siempre tienden a variar dependiendo de los recursos que estemos buscando para nuestros campesinos. La siguiente, por favor. Algunos de los sectores representados, como habló Emma, son los sectores de educación, de salud, comportamiento, están los padres, están jóvenes, están el gobierno local, tenemos sector académico también y organizaciones no gubernamentales y clínicas de salud, que son los servicios que más estamos buscando para nuestros trabajadores agrícolas. Y la siguiente, por favor. Sé que andamos un poco cortos de tiempo también. Y nuestros logros aquí, pues dado a lo que es la coalición de trabajadores agrícolas, es que damos abogacía a nuestros trabajadores agrícolas. Nos vienen a buscar, damos asistencias de pago de luz, de agua, de renta. Damos servicios de trámites de documentación con el consulado y también tenemos los eventos de salud y clínicas de vacunación. Ahora que pasó la pandemia, pues teníamos clínicas móviles casi cada mes y también hacemos desarrollo de capacidades. Estos son algunos de nuestros logros y que hemos conseguido con nuestra coalición de trabajadores agrícolas aquí del condado de Yuma.
Next.
Y creo que es la última.
Perfect. Thank you so much, Sally and Emma, for the wonderful presentation. Um, we are running a little shorter on time than planned, but we do want to open it up now. First of all, here's our speaker's contact information. You will receive the slides and follow-up, so you can have this information. Let's go to the next slide. And this is where the recorded content will end for the webinar. So thank you all so much for those watching the recording.